Hi, is anyone else there? I think I see Denise and Matt.
Yep, Matt here.
Hey, Matt. Hey,
Hello.
Denise, can you hear us? Can we hear you? You will need to be on the Twitter mobile app on your phone in order to speak. It looks like Denise is still listed as a listener, so we will get her virtual microphone, so to speak, soon. I always find this part very awkward where I'm just like standing in the middle of a stage, sort of doing slow motion jazz hands, waiting for things to get going while the crowd accumulates.
I think you should do fast jazz
Fast
hands.
jazz hands, except
That'll help.
except on the radio, no one can see me.
That's better.
Still worth doing.
Hey, Denise, there she is. Hello.
Hi. Yeah. Hi.
We have one more sort of core group panelist joining us, and then we would welcome anyone else who wants to chime in because this is that sort of conversation.
Shannon, I see that my wife has joined as a listener, which is good because I forgot to tell her I was doing this. So I'm going to be down in the basement for as long as however this
There you
lasts.
go. Okay. Well, now Matt's wife knows where he is, and he's going to be occupied till about 4 o'clock. So I hope she doesn't have to take on too much.
Hello.
Hi, there you are, Dr. Kyeremanteng. Thank you for joining us.
Thanks for having me. This is fantastic, and I apologize running a bit behind, but I'm new to this phenomenon.
All good. All good. Do you know what? I might ask everyone to introduce themselves to start with. Why don't you go ahead and start, Dr. Kyeremanteng?
Yeah, so this is our podcast site, so that's why you see in Solving Healthcare. But I am Kwadwo Kyeremanteng, an ICU doc and palliative care physician department head over at the Ottawa Hospital. I have a podcast called Solving Healthcare where we tackle healthcare related issues with the theme of trying to make healthcare more sustainable. So we talked a lot about COVID, especially of late. And I am a father of three, and probably the main reason I am here to talk about school closures.
Great. Okay. Matt, you want to go next?
Guys, I'm a columnist at many places. I'm a radio host. I'm a father of two kids. I'm just a guy who has kind of been watching this pandemic even kind of before it started, writing about it, interviewing experts about it. And I'm someone who's kind of run out of patience about what we've been asked to put up with lately. So I'm here, I hope, to ask some smart questions and offer some serious thoughts, but I'm also partially here to vent because I'm angry.
Got it. This is a venting safe space. And I will add, this is Matt Gurney. I think I was referring to you chummily by only your first name, just so people know who you are. Denise, please go ahead. You want to introduce yourself?
Sure. I am Denise Balkissoon. I am an editor of the Ontario Bureau Chief at the Narwhal. I am the mom of one son who just turned 8 2 days ago. And I would like to say thank you for grandparents because he is at my parents' house today. Thank you for vaccines as well. And he apparently loves virtual school at grandma's house.
Oh, there you go.
Maybe I will just send him there to live forever.
Grandparents are magical helpers in this case. I'll go last then. I'm Shannon Proudfoot, and I'm the Ottawa Bureau Chief for Maclean's. And I have also, just in the last couple of months, sort of become this de facto parenting columnist because I keep writing these pieces that are just basically primal screams of frustrations about what I see as the unfair things that have been asked of families with young kids. And I wrote a piece this week about the hell of online school. And we sort of thought it really struck a nerve. I have to say, I've never had response like that to a piece I've written. I think it like went bona fide viral. Last time I checked, there were like 240,000 readers. So evidently none of us are alone in our concerns about this. So I thought it would be useful to have a conversation about it. I know these things aren't meant to be super formal, but I wanted to, just because we have Dr. Kyeremanteng's expertise at our disposal, I thought I'd start by kind of teeing up, asking him a couple of questions to get us started with, which is, from your point of view as an ICU physician, the medical end of this. What to you is sort of are the important things we need to keep in mind if we're talking about school closures or school reopenings from what you've seen medically from COVID and from the spread in school populations? Like, what do you think we should be keeping in mind?
Oh, this is a great question, and I'll try and keep it as concise as possible. what we know from data from our own country, from the States, from Norway, is schools don't appear to be a major source of spread. Kids don't seem to spread it as well as adults. Usually, you think of a kid in a class, and what we see is that we don't see as much secondary attacks. In other words, you might see a kid or two get COVID from that initial child, but you're not seeing half the class get COVID despite being in close proximity and so forth. And so this is why I always ask the question when people ask me, well, we can't go to schools until they're deemed safe, and I always go back to them and say, like, what's the evidence that they aren't safe? The second part that I think we need to consider is the miraculous nature of COVID not affecting kids like they do affect adults. Like, to give you some context, the data out of I think a German paper recently came out showing that if you have a healthy child, it's about 3 in a million chance of them dying from COVID infection. So, just to give it some context, like you driving your kid to whatever activity would pose a higher risk than them dying of COVID. And this is before vaccines, and being readily available to some of our younger children from 5 to 11. So, like, really, kids are low risk. And what we need to always remember, too, when it comes to COVID is that, and our vaccines, is the vaccines work at preventing severe disease. So you could have 2 doses, you could have your booster. All of us at some point will be exposed to Omicron and likely will get COVID at some point in our lifetime. But because of I would say, miraculous nature of the vaccines, you're highly unlikely, you're much less likely to be hospitalized as a result. And this is something that we need to celebrate and something that we need to recognize that this is the primary objective. So when we say, our kids, we need to wait till things are safe, we got to ask yourself, what is our overall goal here? Because it can't be our kids never getting COVID. Because I'll tell you now, anybody that's not realistic, and anyone that tells you otherwise is not paying attention to what's happening in the world. So what are we going to do about it? And then everybody in this room could appreciate the devastating aspects of school closure. So mental health has been, we're good. My wife's a psychologist. We're good friends with child psychologists, and they've never been as busy. Our good friend Adrienne Matheson, she's unable to take on new families at this point. Physical health, diabetes, obesity, all have been increased as a result. Child abuse, their social development, and then this is their future. And like, we're just compromising this. Ontario's been one of the most closed down jurisdictions in the world, and like, we need to pivot. I'm sorry if this gets a little editorial. And the last thing I'll say, Shannon, because I could go on forever, is as an ICU doc, I've been dealing with this since I was there for our first case, March 2020. And people that land in ICU from COVID, it's like, we know who those patients are. We know what the risk factors are, and they're elderly. They have medical issues such as diabetes, obesity, high blood pressure, and they're unvaccinated. So really, when we try and tailor our approach moving forward, it needs to be on the people that are of highest risk. And this is, to me, one of the tickets to allowing us to get through this. So sorry, I went on a little bit of a rant, but it's at this stage of the pandemic, it's hard not to get a bit emotional and testy, because like, we need to be doing better. Full stop.
Please don't apologize. That was really useful and excellent. I mean, I would sort of ask a question of all of us then, like, so how did we get here? Like, and it feels like it's gotten very politicized and very loaded lately, because what you're saying, about the very, very low risk to children, like the sort of realistic context here. I don't think a lot of people would think twice about driving their kids to their swimming lessons if swimming lessons were happening, which of course they're not. But I think we've retreated to this sort of place of very low risk tolerance. And like, why have school closures become the go-to measure in this province, particularly, it seems like. Matt, you had a really great piece this week, kind of looking more at the policy and political end of it. I don't mean to like put you on the spot, but like, how is this what we've ended up doing when it's not particularly helpful and it's a known massive harm?
Yeah, no, look, I don't feel put on the spot. I'm here to talk about these things.
I just always end up doing some awkward like moderator Oprah role in these things, which I don't think is the way they're supposed to go, but I don't care. So anyway, go ahead.
Well, somebody has to, or we'd all just be screaming into the void. Look, I think this is what I would say. There are policy reasons that we are here. And one of the big ones is obviously the fact that the Canadian healthcare system is small and fragile, and it has eroded in its capacity during the pandemic. So that's part of what brings us here. But I think your question, what you're actually asking, I think is the more meaningful thing here is, why is Ontario in particular doing this again? I don't like being as cynical as I am on this, but I think Doug Ford is worried about his election in June. He is worried that if he is not able to stop the Omicron wave, which he is not going to be able to do, you don't stop something this contagious once it's loose in the population. I think he's accepted that. And now he's thinking, well, when this is over, in a month or a couple of months from now, will I be able to win my election if I am not at least seen to have done everything that I can? And as I wrote in a column earlier in the week, what I would like for him or anyone else in his government or for Dr. Moore is to explain what specifically we are accomplishing with this. Because if you want to convince me that this is not being done to buy Doug Ford political cover, you have to convince me it's actually being done for some other purpose. And I have no idea what that other purpose is. We don't know what specifically we are closing the schools for. We don't know what we would be unable to do if we kept the schools open. We don't know what the trade-off would be. We also don't know what the metric would be for a safe reopening of schools here, which has left me to consider Doug Ford, a guy who has a proven history of wildly chaotic flip-flops in the face of public criticism and opposition, wanted to keep the schools open for all the reasons the doctor has already explained, but then in the face of a wave that will not be stopped, felt like he had to do something. And I guess it's just become a force of habit here. Like, we have not in Ontario developed yet any other solutions. We have not built out meaningfully our healthcare system. I'm not even sure that we could have in the midst of the pandemic. And this is that we are left with here. And I worry that 2 million Ontario kids are sitting at home these days, not because it's going to meaningfully make this wave of the pandemic easier to bear, but because Doug Ford is being yelled at to do something.
Yeah. And this is part of what's really bothering me, is if there's no justification or metric for doing this, when does it get undone? And what is the off ramp to this force of habit that you talk about? Like, this is and now I think the fourth protracted school closure along with other lockdowns. And it just feels like this is the package deal. Like, I keep in my head using the expression, like, they want to be seen to be doing something, capital D, capital S, like taking this seriously. And somehow this has become just part of the deal. And I don't understand, like, if we don't know why we ended up here, what particularly is going to change by January 17th? What would they have to see change? Now you see them floating trial balloons about maybe opening high schools before elementary schools. And it does feel with this government like those are very deliberate trial balloons. Like, let's put this out there in the media for some like free focus grouping and see how much people scream at us. And there is a feeling of real capriciousness to the decision making here. Like, I think last year, it might have been, remember when they closed down the playgrounds and then, enacted some sort of lovely police state, and people just went absolutely ballistic. And they were sort of screamed into retreat in 24 hours. But like, I kept using these, like, it felt to me like governing by applause meter, like kind of throwing things out there and seeing what people would tolerate, or seeing if it felt to the citizens like things were being done. And then if it didn't fly, you would kind of walk it back. I don't know. I'm rambling. It's just because I don't see what the next step is. I don't see what the end game is here. Like, I don't see how we stop having this as our reflexive reaction to something that's going to be with us for a really long time. Denise, please jump in here.
Sorry.
Sure. I think the really long time part is something that I've been thinking about, because I think that I've accepted that January, what year are we in? 2022 is going to be a mess. When we talk about healthcare being politicized, I think also we need to remember that public school is pretty politicized in Ontario, and that right before the pandemic, the teachers and the Ford government were facing off about a strike, or there's a work to rule thing going on. Um, I am not personally terribly scared to send my individual child to school, but I don't know how to. I don't want to dismiss the fears of people that live in different situations than me, that can't buy fancy masks for their kids, that live with grandparents or other people with illnesses. Um, and so I don't think it's okay to just throw the kids back there and not ask something of the government, because they have neglected children in schools this entire time. Um, and that doesn't sit well with me either. And so what I would ask Dr. Kyeremanteng is, what are the basic precautions you think we have to take, in terms of masking and air filtration and testing and those sorts of things? Like, did you think that your baseline was being met in November or December?
Honest. I feel like this is a loaded question, but I have 3 kids. I've not been anxious about having my kids to school as we've developed more and more data about what we know about COVID and our children. So like I just once again throw it back out to the people. Like, what's the data to support that they're not safe? I'll put it this way: before this latest movement for N95s, I would be in a room, or better yet, a nurse would be in a room with a COVID patient that would cough, that would might sneeze, might yell if they're agitated, wearing goggles, a gown, and a surgical mask, and we weren't getting COVID. And so now I'm hearing that we need an N95. We got to make sure our HEPA filters are in place. We got to do all these things, and I have no problem with improving ventilation and putting these metrics in. But I still haven't heard the data to say why schools aren't safe. And once again, when we put it into perspective, the risk to our kids, once again, are you, this is not a zero risk society. Are you willing to let your kids go on a toboggan hill? Are you willing to them to play sports? Are you willing to, once again, drive them to their swimming lesson? And when you put things into perspective, because one of the things now that I got some media folk in here, is that this fear narrative has been out of control. And this is what's driven so much of our decisions. Like, for us to say, I'm fearful of sending my kids to school, assuming your kid is healthy, assuming that it's not at high risk in terms of grandparents or yourself, like, I think we've done a disservice to the population, because what we have, like, as a doc that treats COVID patients, is perspective. Like, to me, what was scary, like, I was still training when H1N1 came. That was more scary because it was less predictable. Like, I saw young pregnant, we saw that here too, but young people getting sick. We saw people that were completely healthy getting sick, and one of the things that there's always going to be exceptions, but in my 20 months of dealing with COVID, I've yet to see somebody that is completely healthy land in ICU. And this is a narrative that a lot of people are shocked for me to say that but completely healthy as in doesn't have metabolic health either. It concerns either obesity, high blood pressure, type 2 diabetes. I've yet to see somebody that is completely healthy land on a ventilator because of ICU or because of COVID. And I've been, as a guy that gets a little bit of media coverage, I've been trying to preach this to as many people that would be willing to listen. But our whole risk meter has been totally been thrown off during this pandemic, and I don't know the solution.
That is so, I'm trying to think of the right word. Like, that is not, you are right. That is not context we have heard. That is not the narrative. even now with kids in schools, and you're talking about the even lower still risk profile for children. And I find the rhetoric, like when I stick my neck out and I'm sort of mouthy about this, like just open the schools, get the kids back. That's what is best for them. You get this kind of blowback as though you're suggesting people like chuck their kids onto the on-ramp of a freeway. Like that is not the choice we're making here. We're not making a choice between our kids being at home, miserable, emotionally damaged, with their parents stretched beyond the limit. The worst thing I've heard in the last week was Vera Etches, the medical officer of health here in Ottawa, was on CBC Ottawa Morning. And I'm not exaggerating when I say it made me catch my breath. And you could hear how um, delicately and kind of regretfully she was saying this. The host, Robin Bresnahan, asked her about sort of the effects they see when schools are closed. And she said, I'm sorry to say this is so difficult to talk about, but the Children's Hospital of Eastern Ontario saw more babies with head injuries and more kids with multiple fractures when schools were closed, as an indication of how much strain families are under. Like, this is not hypothetical. Like, it's not pretend damage, it's not maybe damage. And I feel like to your point, and doctor, you would have so much more expertise than I would. Like, I just feel like our perception of the risk benefit trade off has gotten so warped. Like, there are known harms on one side and very low harms on the other. And I don't feel like we're talking about it that way. And I don't understand how we get back to a saner place of balance, because it feels like there is this inertia to this very low risk tolerance. And when you layer on top of that sort of more kind of base craven political instincts and a population that's kind of spooked, or at least some very loud corners of it are, I just don't know how we dial this back to a more sane place.
And Shannon, if I could follow up, and as you said, all the things that that clear, as Dr. Ed just mentioned, and all that, like, we know this, and this is one of the things that's, as I'm a bit surprised that more people not willing to speak up, to step up, and I've said this before: if you can't stick up for kids, who can you stick up for? Like, this is a time where people's voices need to be loud. Like, I'll put it this way, as you kind of allude to, we are saying it's okay. Like, when we had those, from April to September, all that school closure, we were saying it's okay that kids are at home with their potential abusers. We know this. Interview Michelle Ward. She's a child abuse specialist. They're at home with their abuser, with no outs, no coach to talk to, no teacher to access. We know a lot of marginalized communities, they don't even have access to internet. Their family has to choose between going to school or going to work. Like, this is our society. What are we saying about ourselves? That we think this is okay? That we are not going to step up and try and be a voice of reason, and a voice to stick up for our children? Like, what are we saying about ourselves? Like, this is, to me, is what is crazy. And I'll tell you, as a doc, it's not easy to speak up. Like, I've seen people get canceled, get complaints from colleges. I get complaints from colleagues, hospital. I've been personally been attacked tons on Twitter in the last week or so. But this is the time. This is the time we all have to use our platforms, our voices, to do the right thing. And if I could provide any assistance in terms of what the realities of COVID are, because this is a thing that a lot of people, they've never even seen a COVID patient. Look at the amount of people on the loudest voices, either on Twitter or on the media, and ask yourself, how many of them have the perspective of actually seeing a COVID patient? And this is the thing, they could give you the numbers, they could talk about the epidemiology and so forth, but do they have the perspective, and do they have a holistic perspective? Because in my job, if I can't just look at the kidney, I can't just look at the heart. If somebody comes in with a problem of the kidneys, I got to ask myself, my management I need to think about how it's going to affect all their organs, how it's going to affect them holistically. Same thing with the COVID approach. If I'm going to put on restrictions, how's it going to affect the children? How's it going to affect cancer screening? How's it going to affect elective surgeries? How's it going to affect all these things? Mental health. We can't just be so myopic. And so once again, Jen, I apologize. I get a little bit passionate about this stuff, but like it's just there's been a line in the sand I think that's been crossed in my mind several times, and we need to be a bit more vocal.
Okay, so I'm going to ask all the scared parent questions, although I just want everyone to know I really, really would send my kid to school today if I could. But, these are the things I see. And I guess these are the messages that if we want schools to open, we have to convey it to people. So my questions would be, what is the difference with Omicron? What is going on with all these pediatric hospitalizations we hear about, which I've tried to read so many stories about them and I can't figure out how many kids are just being rehydrated for a day, and then how many kids are actually there, for a long, long time. And then and then long COVID, right? Everyone's like, long COVID, they're so afraid of it. I agree with Shannon. I don't know, how do we present like the actual risks of COVID versus everything else that you're saying, that I've definitely seen mental health stress in my own child? How do we present the reality of those risks to people in a way that the greater society will say, yes, actually, these schools do need to be closed, to be open.
Excellent. Thanks, Denise, for the question. I'll go in order. So, Omicron, what we know is it's way more contagious, clearly, and we know. Once again, I want everyone to register the fact that we are all going to have COVID at some point, and the magic of the vaccines is that it prevents us from getting severely ill from it. So you could do all the measures you want for your kids or what have you. At some point, they're going to get exposed. So just have that in mind. The thing that seems to be reassuring the thing that is reassuring about Omicron is that it's less deadly. It's less likely to cause you to be hospitalized. It's less likely to kill you. So even before Omicron, the data to support kids being at low risk was already there. So this, if anything, it tells you that your kid is most likely to get COVID, but he's even less likely to get severely ill from it. And the data is now clear. When it comes to long COVID, the best study that I've seen was out of the UK when they compared young kids that either they thought they had COVID and didn't versus those that had COVID. And I think about 2% had on both sides. So to summarize, there was no difference between the two groups. After about 12 weeks, none of the kids had persistent symptoms, and the incidence was, I think, roughly around 2% that had experienced some ongoing symptoms. So this was pre-Omicron. So once again, when you compare kids with a viral illness that wasn't COVID and a viral illness that was COVID, there was no difference in long-term symptoms. And I could find the paper and send it maybe to Shannon. But to me, that was clearly the best established paper. And then how to present the data, I always try and present it as if I'm presenting it to my mother. And I would compare it to things like, when you could either compare it to influenza, compare it to riding a car, going on a plane ride, other illnesses, a kid getting cancer, like all these things, we have that data to compare, and it just kind of puts things into perspective. Because if you just put a random number out, three in a million chance of dying from COVID as a youth, that still seems like to some that might seem very uncomfortable. Whereas if you compare it to what you do on a daily basis, it might shed a little bit more perspective. But I think honestly, I don't want to editorialize too much, but the fear narrative really was working from a ability to attract, like for the ability to attract stories. Like the scarier, the better. And I think this is what just got pushed and continue to get pushed. And it's disappointing. I'll tell you one last quick story too, Denise. I've done media with all major outlets or whatever, but there was a specific media group I've done interviews before where the narrative isn't as scary maybe as one might expect, and the interviews haven't aired. At least 3 times that has happened to me, and I I don't have a good answer on why, except for that.
Right. I guess the other thing is I worry if the school's open, it's just going to be a chaotic closure in terms of if teachers are getting it and always out isolating, then the classes are being sent home anyway, or the classes are being collapsed. I suppose that's better than no school at all. But I think just like there are weaknesses in our healthcare system because of long-term trends, I think there are weaknesses in the education system too, that it couldn't necessarily handle an opening during Omicron, which is also, as Shannon and I were talking about, it's hard not to editorialize when you're a parent and you're in the thick of this. Yeah, but
Yeah,
that's another thing that I think about, like just my kid being sent home for 5 days and then there for 5 days and then back for 5 days. Like that's just as complicated for me to deal with.
'Cause
100%.
was
And that's it's sorry, and that was kind of why Dr. Moore's that Thursday interview, or that Thursday announcement. I got to tell you, like a lot of us were celebrating and saying how brilliant this was. Where you're not having to isolate because of an exposure. If you're asymptomatic, your kid still goes to school. Like the structure changed it, and it was evolved based on the risk Omicron posed to students and to the teachers, knowing that it's less virulent, once again, less deadly, that you could adjust compared to previous. Instead of isolating for 10 days, it's now 5 days. If you're asymptomatic, kids could still go to school. Like those were the pivots that Dr. Moore suggested, and in my humble opinion, made a lot of sense. But this is what was going to allow us to have that less of that on off switch, Denise.
I think we have a couple of other people who want to join us as speakers. So if you do and you want to chime in, please go ahead. I won't put anyone on the spot. I've made the mistake of doing that before and it's horrifying. So please feel free to speak up if you want to join us. Um, yeah, I don't know. I would say, like, Denise, you sort of flicked at this already, and I don't know, this does feel like sticking my neck out a bit because of the way this has gotten so loaded. Like, personally, and I would say this is with the luxury of no extra health concerns in my family. We have grandparents in their 60s and 70s. They're all boosted. We're very lucky. I personally, there is no day since maybe April 2020, when we didn't know that much about how this was going to go yet, that I would not have made the choice, if I had had the choice, to send my kids to school, that I would not have decided that was better for them. Um, and I don't know. I just that is where I am. I know that I have a lot of lucky factors on my side, but I just feel like the discussion about this has gotten so risk averse, and it's almost become like a purity test. Like, what, you want our kids to die? You want your kids to die? Of course not. This is about, like, in an imperfect world, in a horrible, horrible pandemic world that has gone on for longer than I think any of us could have imagined. The least worst thing I can ask for right now is for my kids to be at school and for all kids to be at school. And I just, as I said, I'm really worried about the inertia of this, that now that we've done it, what will make us open it back up?
And
Yeah, go ahead, Matt.
well, I was just going to say, I think one of the other problems we've been running into is that, like, for listeners here who don't know me or haven't read my work before, I have supported reluctantly all the previous school closures in Ontario, because in each one of those cases, this is the fourth now, I thought they were dumb. I thought we could have done more to mitigate them. I think we should have been better prepared. But in each specific earlier instance, I understood what the point was. Like, I understood what we were trying to do with it. When COVID arrived, we shut everything down. And we shut everything down because we didn't know what we were up against. The hospital system was unprepared. None of us had kind of gone to pandemic boot camp yet. A broad societal shutdown, though costly, made sense. I was like, okay, I understand what the purpose of this is, and I could
Absolutely.
explain.
Yeah.
I could explain that to my kids. They're not old yet, but I could tell them we're doing this so that we can buy time. And then the second school shut down, and then shortly thereafter, the third one. Those were the shutdowns that bought Ontario and other Canadian jurisdictions on different timelines, but that bought us the time to get the vaccines that had not existed at the beginning of it. And then it bought us more time to get those vaccines into arms here. So I could understand the rationale of all of those. But what I've just been asking And no one has been able to answer this to me yet, is what is the point? Like, this time specifically, what are we going to use the time to do? And there are like some answers that come out, which is, well, we're going to boost more people, we're going to vaccinate more kids, we're going to distribute more air filters and masks to classrooms. And I go, oh, okay, cool. And when we've done those things, the schools will reopen, and then you just get awkward silence. Like, what I'm specifically asking for is, like, my children and 2 million of their buddies have been ordered to make a sacrifice on the behalf of society. Okay, can someone tell me what it is for? And the awkward silence that prevails when I ask this is leading me back to my original conclusion that this is because Doug Ford will be accused of not having done everything he possibly could if there is a wave in which he does not close the schools. And I'm very pragmatic. If my kids' schools run out of teachers because they're all in self isolation, obviously my kids don't go to school that day. Like, I'm a realist about that. But it just seems to me that we've kind of gone from, we will close which specific schools must be closed based on their own circumstances, to we will close all of them. Why? Well, because we will. And I think it's a little bit the difference between closing the schools when there is a snowstorm versus because it's winter. There is a wave of COVID now. It is stressing the healthcare system. I'm not a denier about this. My kids are vaccinated. I'm triple vaccinated. I've done everything I can. Would someone in authority please tell me what this latest sacrifice is buying for other more vulnerable people? Thus
We're
far,
supposed
no
to.
one
Can
can.
I?
Sorry.
Oh,
We're supposed to be giving the original lockdown. We were supposed to be giving the government time to fix all of these things that our teachers have been striking for improvements. Like, honestly, like, as a teacher, I'm listening to this. I really like how, Shannon, you mentioned that we have these problems in schools that are not new. These old ventilation systems and the inability to distance, and old sinks that kids can't even drink from because the water systems are old. These are things that Doug Ford and Stephen Lecce were given time to address that first summer. And what did they do? Nothing. Time and time again, we've given them time and they've done nothing. And now we have this opportunity again for them to have time to fix things. And I feel like we're being pushed into a situation where, again, just like with special ed students, teachers are going to have to strike for things that citizens should have the right to: healthcare, support for special needs, safety. I'm, I'm so upset. I want my daughter to be in school face to face too, but I don't want to be rotating between 500 students every week without proper ventilation or distancing. It's ridiculous. I'm sorry.
And I'm a teacher as well. And I would say, in full disclosure, I don't have children myself, but I'm a teacher. I teach intermediate, wonderful group, and they need to be in school, and they need to be in school face to face. They suffer from mental health issues. My one thing I would say is, when you talk about what are we sacrificing for, well, my dad has to go in for cancer treatment that's possibly going to be pushed back because our healthcare system is collapsing. So if you want to sacrifice, that's why you're doing it, so people like my dad can still live. And then the second thing, one thing I would say is, I get that students aren't as much at risk for COVID, or as much at all as any other group. Why do the numbers, and I don't understand this, I'm not a doctor, so I'm asking for the doctor to explain. Why does the COVID numbers overall in the community go up when schools are open and closed when schools are down? And why, as well, would this COVID virus be different from any other illness? Because parents know kids get sick, and parents know that kids pass it on. They don't get severely ill, but they get sick. So if someone could answer that for me too, that would be awesome.
Can I, Shannon, just jump in for 1 second just to reply to the last speaker there? I am obviously sorry that your father is ill. That sucks. In our family, we've now had 2 necessary surgeries deferred because of exactly this. And I'm not blind to the sacrifice that other people are making here. I have specifically asked people in positions of authority if the current school closure will meaningfully protect the healthcare system, and the answer thus far has been no. The speed of Omicron and its scale is simply too big for it to make a difference. It could delay a peak, and it could somewhat accelerate an exit from it. That's basically the best case scenario here. It's so vague, though, that we are putting the very real harms that shutdowns impose on children up against the potential limited benefit to the healthcare system. Every choice we've had to make in this pandemic essentially is a cost benefit analysis. We only have half that equation for this one, and yet people are awfully certain we're doing the right thing, even so.
Yeah, that's a good point. I was going to say something sort of similar. I will defer to the doctor next because he has way more expertise, clearly. But yeah, I feel like we've gotten into a bit of a. You're right. It's horrible that your father needs treatment and can't get it. I feel like the problem is we've sort of confused one set of problems or benefits for another, or we've gotten into sort of a bit of a bait and switch. I'm not for a moment suggesting that's where you are, but we've gotten into this idea that like if we don't sacrifice something, it means we don't care about the things that aren't going well. But the point that I'm hearing again and again is that closing schools is not actually going to help with the things that are legitimately really under stress and are going to have major repercussions right now, like deferring surgeries. I can't even imagine what it would feel like to have cancer in your body and to need to have it removed and to not be able to do that. That is horrific. I would never minimize that. I would keep my kids home for the rest of the year if we needed to, in order to not have that happen to people. But what I'm picking up from what I'm reading and hearing is that those two things don't go together. Like we can't make that trade off.
Yeah, sorry, I want to also just send my condolences that your father's having to wait for surgery, and this is exactly, in my opinion, the last thing we want, and this is why we're ultimately trying to protect the system. And I think my viewpoint is just we're approaching it the wrong way. We're doing it the exact same thing 2 years in, and and to me it's been ineffective. So I'll get to each one of your comments. I think hopefully I don't miss any, but in terms of the hospitalizations, why we're seeing more kids hospitalized, you gotta we gotta remember that when something is as widespread as Omicron is, what if you come in for just getting you could go in for a psychiatric assessment and swab positive, that's a COVID. You're counting as a COVID case in hospital. If you come in because you can't breathe and you swab positive, obviously that's a COVID admission as well. So it's hard to delineate what's what is, and that's what the challenge that we have at this time, because basically almost everyone. So I should rephrase. A lot of people coming into hospital will be COVID positive, whether they have symptoms or not. And what I'm hearing from my pediatric colleagues, especially those in the intensive care unit, the ones that they see are usually people with complex care needs. That they've, in other words, have been in hospital, been hospitalized several times due to several, like, because of their chronic medical conditions. Regarding the correlation with school closures and the waves, we got to remember when you compare regions that close schools versus that don't close schools, we're not seeing a difference. I think you're doing 9 things at the same time, and so for someone to try and look towards causation during that time period, I think is an issue. And COVID also has a natural wave to it, like in previous waves, it's around that kind of 8-week to 12-week kind of peak and trough. So to be able to point towards that intervention, that single intervention being of impact, it's a really hard thing to do. And once again, when you compare regions that have had school closures versus those that haven't, like British Columbia, even within our own country, you could do that. British Columbia, Quebec, Ontario seems to be doing worse off, arguably. In regards to going back to like being able to support your dad during this time, there is a lot of young families out there that like my wife, for example, she's not she's a psychologist, but she's having to stop her clinic to help take care of her kids. You know what I mean? There's going to be frontline nurses that have to stay home at this time to make sure that their kids are getting educated. Then this is one of those actually, I should say, many unintended consequences of our actions when it comes to COVID policy. And so, and then your last question, I think, was about why every other virus seems to spread more amongst kids. I can't tell you why. Say if it was influenza or if it was gastro, that seems to really spread more amongst kids. But this is one of the, I've been trying to say, like, the gifts of COVID is that it doesn't seem to affect kids the same way as it does adults, or compared to other illnesses. And this is something we should, in fact, celebrate. And I'll keep saying this to the teachers: the number one way you're protecting yourself is your vaccine status. Are you vaxxed? Are you have that layer of protection that prevents you from getting severely ill from COVID? And this is your number one thing. And because, like I said, at some point we're all going to get it. We have to make that pivot in our minds. We can't expect that we aren't going to go our lifetime without getting it. But the best way to make sure that you don't get sick, severely ill, is to be vaccinated. I think I covered most of the questions.
Yeah, thanks. I did just want to say that Peter, totally agree with everything Peter said. I think we're kind of united in recognizing that the government has really, really messed up. It feels like Lecce and Ford, over the past 2 years, they could have mitigated things. They could have changed things. They didn't. We're in this mess. And I agree with you as well that everyone's going to get it. I had it over Christmas, and I was actually happy because then I didn't have to think about what's that going to mean for my class and work and that kind of thing. So we are all going to get it. I believe that it's just a matter of when and how that affects our healthcare system, I guess.
I'd like to thank the doctor for being such a big advocate. I can speak as a mental health professional and a child psychologist. I work in 4 different agencies. And so there's 2 different factors. One, we don't have enough staff because half the staff are busy taking care of their own children. Our wait lists are enormous. Some of them, we have over 2 years waiting time. I spent today, in addition to, forget my own woes of homeschooling, my kids are pretty good, thankfully, but fielding crisis calls from intake workers who are telling me they have PTSD and trauma because parents and children are calling and they're suicidal, they're being sexually abused in their homes, they don't know what to do anymore, and people can't manage this. And so I think the doctor said about a half an hour ago, he used the word myopic. And I think that's a perfect description of what is going on, because the risk of COVID and the healthcare system crashing, those are real risks. But we can't forget the risk of suicide, eating disorders, child abuse. It's significant, depression. And so I see it firsthand. Aside from in my work, I might get 3 to 4 calls a week from personal friends in panic because their children are suicidal and they cannot find resources. And so someone else mentioned the word trade-off. I really, really am greatly concerned about the trade-off, given that what the doctor said, and I agree wholeheartedly with him, we are all going to get COVID. And we need to protect our children right now because this is irreparable damage that we're doing.
Doc,
if I just, oh, sorry.
Sorry.
No, I just had a quick question for Dr. Jen there. Doctor, one of the things I wonder about, and I don't know, I don't have your expertise, I don't have your insight, but this is honestly just something I wonder about, is going to be the long-term impact on children, not of any particular stress or trauma or horrible thing, but just of the fact that so much of what you and I and most of us here would have taken for granted in our childhood, for them, will not be ironclad things. Like my daughter is older. She has memories of before the pandemic, and she understands that the last 2 years are anomalous, that they're weird, that it's not normal, that eventually it will be over. My son, who is younger, has never had a normal year of school. Every year of his schooling thus far has been at least in some way disrupted. All of his activities are conditional. He loves playing hockey. The leagues get shut down over and over and over. Like, I'm just wondering, and I guess we'll find out in 30 or 40 years, but we have millions of kids in this country who are going to grow up. And for them, school is not sort of this ironclad foundational thing of your early life. It's this thing we turn on and off like a light switch.
There was a doctor I saw, I can't remember her name now. She was very articulate. I saw a post that she made, and she was working in Africa. And she had talked about in her post, she was a teacher, she's also a physician. She talks about every time we deny education to children, we're affecting their long-term potential. And I work mostly with very high risk, vulnerable children. Most of the families I work with, a lot of them don't even have one laptop, maybe. These children are already risk of school dropouts. And so we're increasing that risk. Lots of kids are not getting online. And as we know, with people with anxiety or agoraphobia, the more you avoid doing something, the harder it is to ever get back into it.
That part of it is just so devastating. I worry that all these kids are going to learn that they're always waiting for the other shoe to drop. And there's like different tiers of vulnerability and possible damage there, right? Like there's the class dimension. Children don't disappear because schools are closed. There are, a lot of us involved in this chat are sort of comfortably middle class. We have portable jobs. We're at home. This is awful for us, but like we can do it. Like our kids have adult supervision in some capacity, at least some support with school. Like if you're working in an hourly wage job and you either go in or you don't get paid or you get fired, like your kids have to go somewhere. So even on a straight logical epidemiological kind of level, you're probably giving them to a neighbor or asking a friend to look after them. They're still gathered with other people. Like they're not then going into a bubble. There's not, like, they still need to be somewhere. And so that goes further to the question of, is closing schools even solving a problem? But then there's the loss to it. Like the school that my kids go to, there's a breakfast program, a lunch program, a clothing cupboard. They told us last year, like the number of families in our school who didn't even have an internet connection, let alone like enough laptops for all their kids, was unbelievably high. And so now those kids don't have access to those basic, I don't even want to use the brand amenities, like needs being served. They don't have the connection to their teachers. Their teachers will just lose track of them until whenever this ends. Like as much as like we're probably all in different ways seeing the ripple effects and the emotional effects and the developmental effects in our own kids who have a lot of advantages, there's entire other swaths of the population that are going to sustain much, much deeper damage here. It's not hypothetical, like it's a real thing.
I think Shannon, this is probably what really breaks my heart. It's like the loudest voices have been throughout this pandemic. We call the like Zoomist, or I don't know what the term is. The people that can work from home and have that privilege, and the ones that are screaming "stay home" were the ones that could stay home. And we started a charity actually as a result of what we were seeing from the pandemic called Bridges Over Barriers locally, because of exactly what you're saying. Like there were families like this. It breaks my heart thinking about this, but there's families that were like, we got to choose between diapers and food, and now we got to also choose between going to work and educating our kids. And then I think I saw the stat in Ontario, 100,000 kids like just lost, like where they're not in contact with their teachers or their school, and this is their future. And I just, to me, what does that say about us? I keep saying that, but like, what does that say about us that we could turn a blind eye to this? Like, we don't even talk about things that we could try and do to mitigate it. We're not talking about investing in mental health. We're not talking about providing mental health services for those that can't afford it. We're not hearing any of that. We're just
mental health services were cut in the TDSB at the beginning of the pandemic. We lost all of our guidance counselors. Like it's insane. Like you'd think that these issues that you're bringing up, which are very real issues that, like, I think they predate the pandemic. Like, I've been seeing these needy communities and teaching in them since the early 2000, and this whole question of can we address the needs of these groups through standardized testing and things like that? No, we need our government to actually support these people. We need our government to actually be providing the things they need. We need to they need sick days. Like, the parents shouldn't have to choose between feeding their family and educating their family. And it's ridiculous that instead of our governments putting more supports into our public education system for mental health, they're pulling them out. And I don't know about other boards, but I know in the TDSB, the need has increased. And because we've lost these guidance counselors, we've lost the supports as the need has increased. To me, it looks like they've used the pandemic as an opportunity to further dismantle public faith in public education. Like, look at all of, I don't know if you've noticed the ads for private schooling that have suddenly increased. This is why.
I think it's related also to what Shannon said about schools and basic needs. Schools and teachers are actually front line for children with respect. I'm an expert in child abuse, and the majority of the clients that I see, their disclosures about being harmed by caregivers actually comes at school. They often tell a teacher, or a teacher witnesses it.
Oh
And
yeah,
now
I
there
know.
are
I've reported a number of them.
right.
I know.
Right. So now there's no other adults having their eyes on children. And in addition to, I'm not suggesting all parents are I think also with the rates of stress and everyone being under tremendous financial burden, homeschooling burden, parents are lacking the capacity maybe also to manage their own emotions. So the rates of child abuse are increased and no one's helping these kids. So school closures are really problematic on a very large scale level.
Oh, I agree. I agree. But when they go back into the schools and they don't have the guidance counselors there to support them, and when they don't have the smaller class sizes in order to make it so that teachers can work with them one-on-one, these are things that we need to be addressing at all times, not just teachers addressing them during negotiations.
I keep thinking about this in terms of sort of a broken social compact of some kind. As Matt was outlining, in the spring of 2020, we just didn't know enough. And it made sense to just shut everything down because we didn't know yet what was higher risk, how bad this was going to be, what we needed to do. So those first sort of 3 or 4 months, I sort of give a pass to. We've learned a whole lot since then. And I just can't help feeling like we have asked kids over and over and over to sacrifice, and not just to sacrifice things that you could consider frills, which I would argue are not. They're really fundamental parts of childhood. As Matt was saying, the things that we would have taken for granted. But we've asked them to sacrifice, hockey lessons, ballet, swimming, birthday parties, just normal stuff, time with their grandparents. Good God, like the years of grandparenting that have been lost to this. And as time has gone on, we keep asking them to sacrifice, and it's not clear anymore what for. There was a time when it was nobody was vaccinated and we need to protect your grandparents or everyone in our society because we don't know who's going to fall to this. And now we're still asking them to sacrifice, and I don't feel like we have kept up our end of the bargain. I remember one of the early moments that just broke my heart as a parent was Halloween 2020, when they essentially said, Halloween is canceled. That was a small thing. Of course, that was a bonus. But in a year where kids had already given up a lot, you had all kinds of infectious diseases experts saying, like, you couldn't design a better childhood activity that would be more safe, outdoors, masked, spread out. And it was just an indication to me that if we needed to expend a little bit of extra energy or ingenuity, for kids, we just wouldn't do it. We would sort of just say better safe than sorry. Like, look at the little plexiglass fish bowls we've built in order to keep restaurants and stores functioning. I mean, I know there's a lot of questions about whether they help or hurt, but where it's been in service of commerce or of something that we have deemed to have real tangible value, we have put forth all sorts of effort and creativity, and we've really tried. And with schools and with kids, it feels like we've just gone kind of tisk tisk. How dare you ask for more? Better to be safe than sorry. Stay home. Anyway, I think we have run our hour. I'm going to let anyone who wants to chime in with some other thoughts before we wrap up, please go ahead.
Shannon, I would just
Go ahead,
say,
man.
this will be my last thought. Obviously, thank you for moderating, for hosting. Thank you, everyone, for listening. You mentioned the broken social contract there. There's a series of broken social contracts because we knew after the first SARS epidemic that our long-term care homes were vulnerable, and we let them become scenes of horror during this pandemic repeatedly. People not only dying en masse, but dying terribly. We've obviously broken faith with the children and the students. And the great unspoken part of the social contract for Canadian healthcare has always been, yeah, you'll get your hip replaced slowly and your MRI will be booked 5 months from now. But if you're seriously ill, the system will be there for you. It will save your life. We've already heard from people on this talk today. We've already seen the stats. We've broken faith with that too. There are people who are going to die in Canada, who have already died in Canada, because the healthcare system was not there for them. I don't know where we begin to rebuild this when we're done, but we will spend more time cleaning up the mess of COVID than we ever spent living in it.
Yeah, I mean, I think for me, as Peter, who is a teacher, said, and as with so many things with COVID, none of these things are surprises for us. And those of us who are only feeling it now are the ones who were privileged enough and lucky enough to not feel it before. And so, so my question is, for me, who I am working at home, and all of us who are working at home on our computers and able to send our kids to our grandparents or, find a babysitter to pay or something, how are we going to participate in those conversations over and above COVID? Like the issue of kids not having tech or having internet access, that's also a really old story. And so are we just going to fix it for our kids right now? Or are we actually going to say, okay, teachers have been saying this for a long time. Nurses have been saying this for a long time. It's totally broken. Are we going to try and fix it? Or are we just going to try and put a little Band-Aid on for our own families? So that would be my final thought.
Yeah, thank you. Excuse me. Once again, Shannon, Matt, and Denise, for the opportunity to speak candidly about this. My thing is that let's ask for more from our decision makers. Like, once again, I want everyone to leave here thinking to themselves, how are we actually going to get out of this, approaching this the same way that we've done for 2 years? Because when that next variant happens, say 4 months from now, are you going to be comfortable going back to shutting down economy, school closures, gyms, what have you? Let's ask for more. Let's ask for a way that is going to be more sustainable. Let's focus on interventions, stuff like, realizing who is at risk and providing therapy and treatment for those that are at risk as a priority. And always remembering, like, let the data speak for itself. Let's not get too caught up on the politics, virtue signaling. What does the data actually tell you? Keep asking yourself, what are the risks to my kids? What is the actual risk to my kid if they contract COVID? What is the data to support that schools are unsafe when it comes to COVID? Because I want to say the teachers brought up great points of stuff that we need to get better, absolutely, in schools. But I still say to this, when it comes to COVID, what is our overall goal, and are schools really putting our kids at risk in this current state? Because honestly, we're at the stage that we need to move on. We need to move forward. The kids have gone through enough. So those are my thoughts.
Schools are kids are at greater risk without schools. Those are my thoughts.
I guess my last thought would be sort of a plea. I just would really like us to start treating kids more like full human beings. You know, they're not little accessories. They're not a bonus function. Like if we can protect their childhood or protect their education, we will, but like that's a lot to ask. I just really think we need to start treating them as real people with needs and with rights, and we need to start taking seriously the damage this is doing to them. They are resilient. They will bounce back, probably, like not all of them, not completely. But how are they ever going to even begin that process if they keep learning that the rug can be yanked out from under them? The saddest thing of all, I'm sure everyone's experienced different versions of this, is when you tell your kids that school is going to be closed and they don't actually react that much anymore. Like they just kind of are like, yeah, okay, I guess I figured. Like that's, we need to get them out of a place where that's what they have to think about. Anyway, I want to thank everyone who listened, who spoke. I'm so glad we had some educators and mental health professionals join us here. I really thank you for your expert input. Thanks everyone for being part of this. It felt like a really useful conversation, and I don't know, let's keep talking about it on the Twitters or elsewhere. Thank you very much for your time, everyone.